Hi, I'm Edward Conn. I'm a dual diagnosis psychotherapist with a underpinning in transpersonal psychotherapy. So my background is transpersonal psychotherapy and dual diagnosis. Now, dual diagnosis is the combination of an underlying mental health problem with an addiction. And this is a very complex field to deal with because you have two simultaneous issues. You have the mental health problem and you have the acting out behaviour of the addiction on top of that. And one of the kind of classic things that they worry about in dual diagnosis is how much is the actual problem of the addiction itself and how much is the mental health issue underlying it. And the truth of the matter is it's actually both. So in order to treat addiction, and most addictions can be considered to be dual diagnosis, you need to know how to, in combination, treat the mental health problem and coincide that with dealing with the actual addictive behaviour as well. And on the whole, that is pretty much too much for many therapists and treatment centres, unless you're doing long-term residential, to be able to do, because that is a complex ask. Now, addiction itself usually befuddles a lot of professionals. Therapists can feel very much out of their depth with addiction, and they don't really know what to do with it, apart from kind of really advise people to stop what it is they're doing. But in general, in my experience and feedback I get from my clients, is the insights or directives that they get are really well below the par of what they need. And as a result of this, they don't really get much out of that. So that is clearly a problem, because when there's a need, that need isn't being met. So from my point of view, my background goes back 20 years of dealing with complex addictive behaviours. I've worked in quite a lot of different areas as a result of my broad background, and I've really built up a very comprehensive database of how to deal with so many different issues that people present with, and have built up a very cohesive way of effectively treating those issues that people are bringing in. Because on the whole, what you see is similar patterns with person to person, and that then starts to illustrate to you ways through that, directions and directives that you can give people, and effective ways and effective tools that are tried and tested. And that's pretty much the foundation of what it is that I do. Now, when you're dealing with an addiction, the way I look at it is you're not really dealing with the addiction. What you're dealing with is the person, and it's the person who has the problem. The addiction itself is what I would call an acting out of behaviour. It's a display of their own inner state, and it's a display of a lack of self-control, but also it can be a display of a celebration. So you have two components to that. You can have the depressive side of the issue, and you can have the elated or the exuberant side of the problem as well. So this is also an area that often confounds therapists, knowing why somebody does what they do, because sometimes they'll do it when they're depressed, sometimes they'll do it when they want to treat themselves. So that tends to confound a lot of people because they cannot see the reasoning in that. But there is reasoning in that, and the reasoning in that is because it's emotionally driven. So an addictive behaviour is an expression of a emotional drive. And on the upside, that can be an emotional drive to celebrate, reward oneself, treat oneself. And on the downside, that can be a reaction to a low mood, a depressive state, an anxious state, a negative emotional state. So you have two expressions within addictive behaviour. You have a high expression, a positive emotional expression, and you have a low emotional expression, which is a depressive emotional expression. And the key thing to understanding there is that the addictive behaviour is driven by the emotional background. And it's understanding that begins to show what an addiction is. It's not really a voluntary expression of behaviour, but that's true. You know, it's one of those things that upsets family members or partners. You know, why can't you just stop this? You know, rein it in. Don't do it anymore. Don't drink so much. Why do you use cocaine? And of course that is a rational perspective, but it doesn't get to what the heart of the issue is, that it's emotionally driven. The cognizant part of the person isn't active in relation to that emotional drive. It's actually separated. And it's that separation which creates the helplessness within the addictive behaviour, or the addictive expression of what the underlying condition is, and makes people be helpless around these behaviours. And again, there is a very good reason for that. It's because the behaviour itself is a learned behaviour. And that's really what addiction is. It's a behaviour that has been done again and again and again, and it has become learned. And when something is learned, it becomes effectively habit. And habits are triggered by our underlying emotional disposition. But the way in which that you act that out is no longer under your conscious control. And that is really kind of crucial to understand, because when it's not under your conscious control, you have no control over it. The behaviour is acting through you, and that creates the helpless aspect. And that is the chronic debilitating power of an addictive behaviour, habit, stroke, addiction. And we all know what that can look like. That can look like somebody who ultimately will be killed by their behaviour, by their habit, the thing that they cannot consciously stop themselves from doing. And this is why we consider addictions to be such chronic states, and potentially are chronic states, and why they take lives. And it's for this very reason that myself and my disposition and way I go about tackling addictive behaviours with my clients is predicated on the idea that this is something that could kill you if it's not addressed, potentially. And what that does for me is it really focuses what the importance of this treatment and my focus and absolute commitment to that person needs to be. It focused minds. And focusing minds is a really, really important part of being able to address what the territory is within an addiction and what the territory is for that particular person. So that brings me on to my second point, in that treating addiction from, again, my point of view, it needs to be a bespoke, tailored process. And this is one of the areas of addiction treatment which I think is grossly misunderstood. The vast majority of addiction treatments, centres, approaches, they run a system, they run a methodology. It's relatively low level, it's very generalised in the way it will work, and you're kind of expected, if you get some therapy with that you just work on your issues yourself. And I just don't think this works, because again, in my experience, and my experience is based on what does work, getting results, getting consistent results, my experience tells me that you need to work with a person's underlying issues. Now, what has taught me this is being a psychotherapist. That is what a psychotherapist is. It's dealing with each person and their story that is individual and unique to that person. And that is what you're treating. You're treating that person entirely in the context of the story of their own personal narrative and their own personal process, their own personal experience, what they've been through, what they're going through, and how that specifically affects them. That is essential. You cannot treat an addiction with any expectation of consistent results person to person unless you do that specific approach. Why? Because that's what the person needs. They need their behaviour, their acting out, to be made sense of to them in their environment, in their world, how it activates and how it arises with the triggers and circumstances, the historical contributions, the elements that make up that whole cluster of behaviours and components. That needs to be and is specific to each and every person. And when we communicate to people on the level of their own particular story, we are talking to them directly. We're talking to what it is that they identify to. And people identify to what makes sense to them or what they know. An ideology doesn't do that. And that is problematic, because an ideology takes your attention actually away from yourself to a degree, and it eulogizes an idea that this problem is somewhere outside of yourself, or the resolution of it is something which is slightly outside of your control because you are helpless to it. Now that's the standard kind of 12-step model approach, the disease-based model, the AA type approach, and it proposes that your best option is simply to stop, and you won't be able to get beyond that. And that's what we call primary recovery. Primary recovery is the recovery from the behaviour itself. So you stop the behaviour, that is the resolution that you will get. Now, that isn't really what psychotherapy does. So what psychotherapy does when it's done properly is it looks to resolve the underlying issue that created the problem in the first place. Now, this is very rarely applied to addiction, because the addiction field is generally built upon the idea of what is primary recovery. Solve the behaviour, and that's pretty much the best you can do. That's what you're going to get. And of course, that is a good outcome. But what it creates is the idea of potentially the dry drunk, the person who doesn't drink anymore, but they still have all the vulnerabilities of the person they were in the first place. So psychotherapy does something different. Psychotherapy, by design, as I say, when it's done properly, is about resolving the underlying issues. And in addiction treatment, what that is referred to is secondary recovery. And secondary recovery is dealing with the underlying issues that are pertinent to that specific person, resolving their underlying issues. Now, when you do that, you effectively are fixing the person. And the way I kind of envisage this and the way I understand this is that the addictive behaviour, the acting out, the thing that person does in relation to their substance or behaviour or alcohol or whatever it might be, it's built into their emotional system, and it's an expression of their underlying discomfort. Stress, anxiety, pain, depression. That is the underlying emotional components, and it's those that are driving the addictive behaviour. And what I've found over the years is that if you resolve the problem, a little bit like a barometer, the temperature or the pressure goes down. So underlying emotional pressure through pain causes internal raised emotional pressure. And that pressure is what triggers acting out behaviour. Why? Because that acting out behaviour is a way of trying to discharge the pain, resolve the pain, numb the pain, get away from the pain, running away from it, etc., etc., etc. So if that underlying emotional distress, trauma, etc., etc., is not resolved, you have basically a person who is still wounded, who of course then would be vulnerable to use, if that has been their chosen method of how they deal with their pain, right? So primary recovery says resolve the drinking or resolve the drug taking or the sexual acting out, whatever it might be, and you're better, which of course you are. But it doesn't get into the wounding to resolve the wounding. And it's not that in these approaches that isn't understood. It is understood, but a psychotherapeutic approach is not taken with it. It's dialogued about and it's understood as being there, but the depth of actually resolving it and also what stems from that isn't done consistently. And that then delivers a certain degree of result for some people, but for a lot of people it just does not touch the sides of what it is that they need. Some people can go along with that ideological type approach and get something from it, but in my experience a great deal of people just simply cannot, and it actually alienates them because it doesn't really give them the intellectual insight and understanding of what really is going on for them. And when they apply it, they maybe get some aspects out of it, but really it doesn't get into the hardware of what it is that they need to change. And therefore it falls short for them, and they just intuitively know it's not right for them. And I've seen this for many, many, many years, and many, many people tell me this, and it makes complete sense to me because it lacks an intellectual, integrative way of understanding to yourself why it is that you're doing this. And that is imperative to understand, because if we don't understand ourselves, we can't make sense of ourselves, we can't make sense of our behaviour, and therefore we are alienated from ourselves. And that cannot and can never be a self-acceptable thing. You're always at odds to yourself. And ideology does not fit that in. Ideology is best an attempt to fit a philosophical approach to something. But if it doesn't work and it isn't consistent and it doesn't get consistent results, there's something falling short in that. So how I've got around that is by listening to people, listening to what works for them, what doesn't work for them, and building up tools that can be applied that get into all of the various different components, and there's a lot of them, that can be tried and tested, and the results of those can be seen. And the results of those can be seen to work across different addictive behaviours and with different people and different circumstances. And the information that gives me back is feedback that those tools work, and that validates the tool. So I don't expect people to believe what I say is the answer. What I observe when I'm dealing with people and I'm treating people is I'm dealing with the outcomes of what I observe is happening. It's the outcomes that drive my treatment methodology. I'm looking at outcome alone, and looking at outcome really is very important from my point of view, because I'm always looking for change, and change is what the client wants, change is what the client comes to me for. And as the therapist, tracking change is how I keep a foot and abreast of what is going on in that treatment. It's the way you keep on top of it, is my way of calibrating what's happening for the person. So you then have a treatment methodology which is driven by results and the tracking of results, and one that isn't just simply about trying to keep someone within a restricted type of behaviour, i.e. abstinence alone. I don't take that approach, in the sense that isn't my way in to the addiction itself. I look at the addiction somewhat differently. I look at the addiction from a point of view of looking at the person as a whole person with various different needs and functions in the world. And the addiction is an expression of those needs and functions not being expressed properly. So my way of, again, getting into that and tackling that is about resetting that person's behavioural functioning, but also their brain functioning, their operation in their environment, and many, many more aspects within that, and resetting those in a way around how a human being is supposed to function. So addiction acting out can be seen as a dysfunctional expression of a human being who is not functioning in line with how they are supposed to and are designed to function. It's really important to understand. So it's an expression of that dysfunctional inner state and functional state. That's what the addiction is expressing. So resolution of that person's comprehensive behavioural patterns, neurological patterns, how the habit has been learned and how to unlearn that habit, are essential to being able to change that behaviour, because that behaviour in the addiction is a cluster of various different significant elements, and tackling one or two of those will not change that pattern. To change the pattern, the way I do it, is the whole architecture of the pattern has to eventually be collapsed. And only when it is collapsed does that addiction have no power over the individual anymore. It cannot be dismantled and collapsed only by one or two aspects being adjusted, which again is part of standardized approaches. So I don't do that. I look for complete resolution, and I look to completely collapse the architecture of that addictive behavior. That's what I set out to do, and my methodologies are designed to do that, and that's what I get with my clients when I'm working with them as they apply my methodologies. And with doing that, they can get incredibly quick results, and those results are entirely sustainable because the whole structural system is being very quickly dismantled, and relief comes very quickly, and sustainable relief comes on the back of that. So that approach changes what it is that you're looking at, and as that becomes dismantled, what you start to see revealed more and more underneath that is a healthier and healthier person with greater control in their life and their well-being quickly returning. So that's what I set out to do. That's what I tell my clients that I am attempting to do with them, and that I need their commitment to that process. The one thing I need from the client is that they need to be ready for change. And when they're ready, they are willing to apply the things that I can tell them and instruct them that they need to do in a consistent and methodical way. And it opens the door on change being made possible. When someone isn't ready to change, it becomes really a kind of process of negotiation. And that's fine. I've done that type of work, and I still do that type of work if it's necessary. But really that's kind of preparation for change. So it's about getting ready for change. But really when I do this work properly, it only is when people are absolutely ready. And when they are ready, it's a completely different type of process. And that often, well, actually all the time, it comes as an incredible relief to people. And on the whole, they're amazed by how quickly they can really take control and change their lives around. So if you want to know a little bit more about that, you can go to my website. It's in link below. Have a look at some of the testimonials there. Have a look at some of the case studies of people's experience with my process. And if you want to know anything further, you can send me an email on there. Let me know that you've seen this video, that you want to talk to me about whatever it is that's relevant to you around whatever it might be, addictions or outside of addictions. I treat all sorts of things. I work with all sorts of people with all sorts of different circumstances and conditions. So have a look at that. If there's anything I can help you with, I will get back to you, and we can have a online discussion and talk through what it is that you need. So thanks for watching. I hope this has been useful, and I'll see you next time when I do another video. Bye bye.